Good evening. I realize it is late. It's quite late. We had been given a task of conducting a pretty serious debate, which I think in the environment has all gone away. But anyway, let's get going. I am talking in favor of all boys. All right, that's my role here, and that's what I'm going to speak about. So, what links these men? You know him. You know him too. He got a Nobel Prize. He got nailed. All right? And these men, you know him? And you know him. He got a Nobel. What did he get? Well, never mind. So, generally, what happens here? All the men from the American continent, a lot of men from the African continent, and all the men from the East Asian parts of our continent are circumcised. And when you are circumcised, your pictures come here on these kind of presentations. So if you have a foreskin, I suggest you please get circumcised. So why are we here? We are on evidence-based medicine. Is there evidence for what I am saying? Of course. The very first paper was written by Lord Abraham et al. many centuries ago. This was followed by the Egyptian pharaohs who published their writings as early as 6000 BC. There were a few other task force writing in the last century. AAP wrote something in 1997, last century. And even now writings are going on. And all these writings suggest that if you have a foreskin, you better knock it off. And as you can see, the pharaoh is blessing the man who is circumcising him. And this is from 6000 years ago. So they are very, very well developed fellows. So circumcision is an operation that has been there for a longest period of time. It has remained for centuries and centuries and is the most common operation performed anywhere around the world today, and it has stood the test of time. Once we go to this, let's look at literature some more, because we are doing evidence-based medicine. This has been discussed, and we are all aware that circumcising boys prevents urinary tract infection, it decreases the incidence of UTI, and a whole lot of very, very high impact journals have articles by very famous people reiterating the same thing over and over again. Pediatrics, Lancet, the who's who of medical literature. And it says more so in the younger boys. So the younger you are, the more quickly you need to get circumcised. What about the costs? Well, cost calculations I think is something that the managers do very well, and there are papers that say it is better to circumcise everybody than to treat a UTI. It is more expensive to treat UTI rather than just knock off foreskins. So as far as the managers are concerned, knocking off foreskins makes far better sense. There are a number of other benefits. For the man, you don't have phimosis, paraphimosis. These are all very painful conditions. You are not going to get carcinoma penis where you actually have to lop the whole thing off. You don't get epidermolysis. And you are doing well for your partner because she doesn't get carcinoma cervix and a whole lot of other very, very nasties. And you avoid this because this says, and this is from a scientific journal, it's for British Journal of Urology International, that says that 2000 men suffer zipper-related genital injuries every year. So you see what a lot of good you can do when you circumcise children when they are very young. So what's the issue with this tissue? Why are we debating this over and over and over again? I simply cannot understand. Robert will follow me and he will very, very vehemently suggest that this is unnecessary surgery. Is it really? I have showed you that it is of great, great benefit. And these benefits are the insignificant. Is the p-value very less or very high? It might be insignificant for the statistician, but we are not circumcising statisticians. We are circumcising young boys. So for the young boys, go ahead, it does them a whole lot of good. What about complications? Aren't there complications when you circumcise? This is the data. This is the data from the US, and that's the data from Israel, where a very, very large number of children are circumcised. The complication rates are about half what it is when you do tonsillectomies. And tonsils are taken out as easily as foreskins. I mean, you just have a tonsil and it's taken out if you go to an ENT surgeon. You don't need much cause. So it's less dangerous than a tonsillectomy. So what are we worried about complications? And doesn't leaving the foreskin have complications? We have seen some of them are ouch complications. What about the task force? Now this is the document that I like because it states very clearly after 10 years of sort of going about and swinging about from yes, no, they have laid their neck on the line. They have said evaluation of current evidence indicates that the health benefits of the newborn male circumcision far outweighs the risks, and the benefits of newborn male circumcision justify access to this procedure. So this is the first time that they have stuck their neck out and said, go ahead, it's useful. Then he will discuss about child's choice and ethics. Now, what child's choice? Come on, what choice does a child have? He just follows whatever his parents tell him. He goes to the school that they tell him. He gets a name that he wants. He just has to follow. He has no rights. So that's it. What right does a girl child have? Earrings are very, very common. Every single girl has her ears pierced when she's very, very little. Did she have a choice? And what do you do by making a hole in the ear except by hanging silly things like this? It has absolutely no value. It is widespread sanction. Almost all girls have it. Some boys do, but that's a different situation. The intervention causes pain. It has complications. It has absolutely no benefit. Still, as a society, we sanction it. So why are we obsessed with this foreskin? I think this borders on gender discrimination. The next question that comes in is foreskin special. Is it all nice things? Is it all very useful for nice things? Is it an erogenous zone? And again, many articles say no. And again, the pediatric article in 2012 says literature review does not support the belief that male circumcision adversely affects sexual function or sensitivity. And they have used vague tests. You can imagine how they are done. So, we can conclude that it's just a tiny bit of skin. Removing it does have its advantages. Many men don't have it anymore anyway, and they are not doing poorly. So let's not get emotionally involved. Let's look at it from a purely scientific point of view. It needs to come out. Just get it out. The Adams want it because there have been reports of circumcision riots in clinics unable to keep up with growing demand. And this is in the infection Lancet infection sort of thing. It is not from some tabloid newspaper. So this is reliable. The Eves want it. And here it is. There's a very nice article that says women support male circumcisions. So the men want it, the women want it, the priests want it. For once, all three of them agree that they need circumcision. They are not fighting. All of them agree that circumcision is a good thing. For a change, they all agree. So, ladies and gentlemen, don't listen to me, don't listen to Robert, don't listen to the priests, listen to God. Because he says in the Genesis, every man-child amongst you shall be circumcised. So, ladies and gentlemen, just don't think too much about it. Just do it. Thank you very much.
Thank you, Sanjay, for shedding wonderful light on this important topic. But right at the outset, I want to tell you that after a long time, you've made this battle personal now. You have questioned the role of ear piercing and earrings, and you know my daughter, and you know your own daughter, yeah? So we're treading on really thin ice here, so don't ever question that. And I also thought of putting up Obama and Osama and George Bush. I had the same pictures, and I said, no, we might have an overdose. But on that point, before I start my presentation, there is a very, very gentle observation that I've made, that if you look at all the areas of the world where there is war at this point in time, where there's shedding of blood, where there are soldiers dying on both sides. So if you look at the American army, you look at the Afghans, you look at Iraq, you look at Syria, you look at Israel, that's exactly where all the bloodshed's going on. I think the prepuce seems to have a calming effect on the male psyche. Thank you, respected chairperson. So why are we talking about this? For the same reasons that it is indeed the commonest operation which is being done in males, and the years really, really go back. And it's approved both by the god of religion and of course the god of money, the god of money, Mammon. And this was widely a non-medical talk until the previous century. Until then it was completely non-medical, it was very sensible. But then it became medicalized only in the 19th century. There is historical backing for this operation. I have no beef with Sanjay on this, except for the fact where Sanjay says that the pharaoh is actually blessing that guy, but you can actually see the choice abuses that he is abusing on that fellow, because he's actually standing up conscious and getting his prepuce cut. So all that is Egyptian for bad language, for the unmentionable. right? So yes, if you look at the background, it was a marking ritual, and it still is. And in fact, one group of people we've forgotten is the Aborigines. They've had circumcision going for the last 10,000 years. So it was all of these things. It was a mark of obedience, initiation ritual, and a fertility offering. We entered the picture and muddied things in the late 19th century. And for some reason, again, coming back to war, it was after the resolution of World War II that there was a huge peak in circumcisions for some reason. Right, so I won't spend time much on this. We're all experts on the embryology. A few pictures for completion's sake about physiological phimosis and pathological phimosis. This is to complete the fact that I'm from St. John's, where this is the pet topic that we have. And these are the figures for the prepuce opening up and having a normal lifetime. And we know that it drops to about 1% at puberty. So the name of the game is to wait. Medical indications, no beef, we all agree. This is where the problems come. Where, like relatives, the relative indications are everything else. There is a whole lot of things which creep in, asking us to do a circumcision for a very medical reason. And these are not the hardcore medical reasons that we discussed there, but the relative ones. So what is the argument against routine circumcision? Why are bananas made not like this and made the other way? I'm sure there's a really good reason. Yeah, not many of us would even buy that in the supermarket if it looked like that. Right. So coming to the big debate about circumcision and urinary tract infection. This is an evidence-based workshop, so we look at meta-analysis, and that suggests that the greatest risk is in the first 6 months of life of a urinary infection. And while the beneficial effect is there in the children who have high risk, the benefit is not in the general population. Hygiene is as effective as circumcision, and the numbers are 1, 1, 1 to prevent 1, the wonderful rule of 1. So I think that is a far cheaper, far more easier option to use soap, water, and a brush. And of course, that boy really knows that his mother standard for him are not so low that he can't, be trusted to wash his own penis, for God's sake. So you have to lop it off as soon as he's born. Well, looking at the American Academy of Pediatrics recommendations, if you look at them, we spoke about this in the morning as well, of decades changing. So I think the year 1989 was the fateful year when things got muddied a little bit and went down that path. And again in 1999, which I call the good sense year, is when a little more sense came back and they said you don't have to do it. So let's see what the next 10 years and the next 20 years come. But this is basically to tell us how shaky guidelines can be. How shaky guidelines can be. I know Dr. Snodgrass has been on those guideline panels, so with respect, I'm going to get down the other way. I will not dare walk down this way. Yeah. So coming now to the inflammatory penile disorders and retraction. In theory, yes, a circumcision should reduce inflammatory disorders of the prepuce and all of those troubles because it's simply not there. But that's not the same alarm with which we go around removing everybody's appendices when they're born, because those are far more fatal and far more dangerous. And just the fact that it's there makes it prone for inflammatory disorder. We're not doing that. Lots of us have earwax, troublesome earwax, and if the solution for that was to lop the ear off, don't think this would be debated at all. But unfortunately, when it comes to the innocent prepuce, we seem to have a different bar. So what do the academies say now? The first word children are taught now as soon as they're born out of the womb is to say stop. We say we don't want to get our penises cut. Now coming to the debate, the huge advantage of penile cancer. This comes from one of those fantastic papers which was published a long time ago. I have the quotation on the next slide, which was again published in the Lancet, not in a yellow tabloid, wherein circumcision was touted as the first link between cancer, penis, and circumcision. And in that study, smoking was not taken on as a parameter because they didn't know back in 1932 that smoking causes an increased risk in cancer. And that has been the mother paper for all evidence on circumcision and cancer. So circumcision was initially touted as a cure for syphilis as well. This is the article from the Lancet 1932 there, and this was the mother article. And remember, this article, respected journal, current cutting edge evidence at the time said that circumcision was a cure for epilepsy, masturbation, which was classified as a mental illness at that point in time, prevention of cancer, and like I said, there's no reference to smoking. So this is the holy grail. And like a bad penny, this debate keeps coming back. It came back for syphilis, and now it's come for HIV. And right now the government of India, is actually contemplating getting circumcisions done to prevent the risk of HIV. So there are multiple articles for and against HIV. I would not go into that. Now, coming to the other area which Sanjay was very dismissive of, he said about sensation. Well, I'm going to let this little boy state whatever he knows. He's counted the number of nerve endings there. It's one of the most sensitive parts. And apparently it makes both people happy, and it's there for a reason. He might ask for it. And like our hypospadia surgeons in the morning said, once it's off, you're not going to give it back. You might take it from his lip, you might take it from his cheek, but it's never going to feel the same as his natural prepuce. This is a fantastic article which came from the Journal of American Medical JAMA in 1965. William Keith Morgan described it. I didn't believe the description till I read it, where he said that a circumcised penis, if I crave your indulgence, the circumcised penis entering the vagina is like going into a sock which is open, whereas the one with the prepuce is one where the sock is rolled up for you, and the immense delight of putting your foot into a sock which is rolled. A very descriptive, a very, very terrible article. The title of the article as well is there, but it's there. These things are being discussed threadbare. So sensation, yes, it does have a role to play. Well, coming to the complication slide, yes, circumcision is not a walk in the park. There are n number of circumcision complications we know. Yes, it is only 0.03 to 7.4, and I borrow from Sanjay's slide and says no one has a 0.03 complication. They have 100% complication. Minor complications like bleeding and denuding, and of course we know there are reports of fistulae and complete penile amputations. Closing time, closing arguments. What does God say? Of course, Sanjay quoted God telling Abraham, but there is a more recent verse. We have to stay with recent literature. The same book, the same God says, what God has brought together, let no man tear asunder. And this is a verse we all listen to at our weddings, but I think God also meant it for this gentle tissue which is there. Yeah. So let's leave God out of the debate. Yeah. What does Mammon say? What about money? Now that's another big picture, because there was a comment in one of the pediatrics articles in the 70s, I couldn't pick it up, which said that underneath every American child's prepuce is $100 bill. All you have to do is open it to take it out. And if you look at this guy, he's keeping the tip as well. Yeah, we're talking about the money and the other thing. And of course, once you take the money out of there, you have to wash it because it's dirty money. Yeah, there's a lot of money in circumcision, and most of it is, it's not blood money, but it's, you know, the unmentionable dirty. Yeah. Coming to safety. Now we did discuss safety of surgery, but we also know that when you leave home on a daily basis, any government in the world would advise you wear your helmet and then get out, you know, protect the head. And I think the Phrygian warriors had it right, because their helmet even looked like the prepuce. Yeah? So you're meant not to walk around with an open head and risk it to injury, but to actually have a helmet on. So I think they knew it there. And you know which of these two guys is at risk of major brain injury. Yeah? It's not the guy with the helmet on, it's the other guy. This is another debate, especially when I was in Sydney, where their families would walk in and say, I want him circumcised, I want him to look like his father, which is a very strong social argument, because that's what they're saying. Now that argument's a little weak if you look at other characteristics as well, because I'm really glad that we don't all look like our fathers, because we'd be in deep trouble if we had to fashion everything around them. So what does the child say after all this? I think that is a very good question. He says, what do you want to do? And these are a few of the websites which are supporting patients who are against circumcision. And interestingly, the biggest site which is very attractive is the one called Intact. It's a cruel irony to call that site Intact. And that's anything but. And this is a question on a serious note which is going to come in, and there will be questions asked, not just of the parents, but of us as well. Therefore, I want to close with this and saying, spare the rod and spare the child. I think we would have to twist that saying a little bit and not let them do thunderous stuff, and to keep it quiet. Thank you very much.